The childhood vaccination schedule is appropriate because of
Mhm.
the vaccine preventable illnesses.
Mhm.
You got your kids vaccinated, right?
Definitely.
Yeah, me too. It's interesting how, and I get it, everybody has their choice, but it's interesting how people are making choices not to get their children vaccinated. And you got, I don't know, 176 kids in Texas that are sick. A couple of them have died
Mhm.
because they didn't want to get vaccinated. And
Right.
it is just like,
And oftentimes it's off of a hunch and not scientifically. We
yeah,
have all this data that supports vaccinations, but, and it is a sensitive subject we have to kind of tiptoe around. But there are people who choose not
Mhm.
to vaccinate based off of hearsay
Mhm.
or fear. And it's to be respected. People are entitled to how they feel, but I feel like we need to focus on the data and evaluate that. And that speaks volumes. The scientific process, as you spoke about, speaks volumes. And that's personally how I made my decision to vaccinate my children.
I do think it's really important to use, accurate sources of information.
Absolutely.
And, looking at places like the American Academy of Pediatrics, the World Health Organization, the CDC, for accurate information in order to make a good choice.
Mhm.
That's what you want, to be able to make a good choice.
Mhm.
And so I do think that that is really important. And one of our, biggest jobs is to make sure that we are
Sure.
getting that information out there in a variety of ways.
And I think that people, parents, I know I've taken this before when I've been in the setting, when my kids are 16, 15, and 8, but when they were of age for vaccination, I would oftentimes ask the physician, I'd say, well, what would you suggest? What would
Mhm.
you do? Because I trust in their scientific process. I trust in their education, their knowledge. And then as a nurse practitioner, a family nurse practitioner, I've been asked that question as well. Patients have said, "What would you suggest? What would you do?" And I always reflect back to the research. And, I appreciate your role in that because without people like you in the position that you're in, we wouldn't have access to a lot of this data.
And I think it's also important not to make a bunch of assumptions. There's a lot of things like, Black people don't get vaccinated or other assumptions. And I think, no community is a monolith. And so I think it's really important to really delve into and know, like,
Sure.
what is your reason? Is it that,
Absolutely.
like, somebody is telling you this, a trusted family
Yeah.
member?
we're not sitting here saying like there's no side effects
Yeah.
to
Mhm.
vaccination. We're not saying that. You're going to have an effect of vaccination. I think you asked me earlier, you're like, I can't remember what your words were, but you were like, man, I got vaccine and my arm hurt, or I got, I had a little fever. And I'm like, you're supposed to.
Mhm.
Like, you're
Yeah.
activating the
Yep.
inflammatory response.
Mhm.
Like, that's what we want to happen, right? We
Yeah.
need you to have some kind of reaction. Like, there's literature to support elderly individuals, so individuals who are over the age of 65. Elderly individuals that get sick that can't have a fever, those individuals do worse than individuals that can.
Mhm.
Nurses will always call me and say, "Oh, Mrs. Smith has a fever to 102.6." And I'd be like, "Okay,
Yeah.
but do you want Tylenol?" I'd be like, "No." Yeah, if she's 105 degrees and she's having a seizure, different story. But 102.6, yeah, okay.
Yeah,
Mhm.
I deal with that a lot when I've worked in urgent care settings and patients, family would come in and they're like, "Oh, their fever was 101," or, their how are they acting? Well, they were playing, they were running around, they were eating. I'm like, "Perfect. Let the fever ride out. Your body is doing what it's supposed to do."
And I think the where immunization can step in for that is that the fever that you're getting from the immunization is nothing compared to all of the different symptoms and complications that you would get from actually having the disease.
Mhm.
So actually having measles can lead to blindness, death,
Yeah,
brain inflammation, pneumonia.
sure.
Whereas the vaccine, you might have a sore arm and then like very rare, side effects. And so I think when we're weighing the risks and benefits,
Mhm.
the overwhelming majority of the information is towards vaccines being a very safe and effective way of preventing this.